Hello everyone and welcome to today's webinar, Law Enforcement and Homelessness, Forging Fruitful Partnerships. I'm Michael Durham and I will be the moderator for today's webinar, which is presented by the National Healthcare for the Homeless Council together with the National Law Center on Homelessness and Poverty as part of the Housing Not Handcuffs campaign. This is a 60-minute presentation with the last portion reserved for Q&A. Please use the chat box below the presentation slides to get help with technical issues or to ask the presenters a question. If you are experiencing technical issues, you may instead call the Council's office at 615-226-2292 and ask for Julia. This webinar is being recorded and will be archived with the presentation materials at nhchc.org within 3 business days. So our presenters today are Eric Tarr, Senior Attorney at the National Law Center on Homelessness and Poverty, headquartered in D.C., and Jeff Youngman, who is a former police officer and current Director of Legal Services at 180 Place in Charleston. And again, I'm Michael Durham. I'm the Technical Assistance Manager here at the National Healthcare for the Homeless Council in Nashville. We're going to sort of tag team throughout the presentation, and I've invited Eric and Jeff to interrupt me anytime they have something to add. But first, we want to learn more about our audience. So we're going to pull up a poll and ask you guys to tell us who you are. Your options are law enforcement, healthcare for the homeless employee, or some other direct service provider, advocate, however you interpret that, consumer, or someone with a lived experience, public official, and other for everything else I didn't list. Give you just a few moments to respond. All right. So we'll go ahead and close the poll. It is a majority of you guys, or at least a plurality, who are working in healthcare for the homeless or some other organization providing direct services to people experiencing homelessness. And just a few of you are with law enforcement. We'll continue with that in mind and kind of describe why we're doing this webinar in the first place. My sense is that if you registered for this webinar, you have a sense of why this issue is important. But just for a little background, the basic issue is that people experiencing homelessness are living their private lives in view of the public, and that can lead to interaction with the police. In many communities, things that housed people can do safely indoors. People without homes can only do outside, and it's illegal, such as lying down or having a beer after a long day of work. And then another reason is simply that we were asked. The National Healthcare for the Homeless Council is a membership organization of mostly healthcare providers and other service providers serving people experiencing homelessness, and we have been asked several times recently to address this issue in our technical assistance work, and so that is in part what we're trying to do here. And then, of course, encampments in particular are proliferating nationwide, and homelessness has increased this past year for the first time in a long time. And we do want to highlight communities in our network that are doing really good work on this. So that's why we're here. We initially designed this webinar with the hope that it would be sort of a training module for law enforcement, and we quickly realized we can't do that in 1 hour. And moreover, in our research found that police departments doing really good work on this issue are being trained by their local provider partners, their homeless services providers. So we are going to cover some Homelessness 101 material, but we're going to spend most of our time talking about collaborations across the country between police and providers and describing the issue in more depth. So let's go ahead and get started by giving a lay of the land of homelessness in the United States. Many of you are probably familiar with the annual homeless assessment report to Congress, which is the official estimate of homelessness based on what's called the point-in-time count, or the PIT count. And that includes provider communities all over the country, going out on a single night in January and counting people in shelters, transitional housing, and people who can be found on the streets or in encampments. And that estimation for 2017 said that 553,742 people were experiencing homelessness. And first, it's important to recognize that that was an increase from 2016, and it was the first increase since the end of the Great Recession. But the problem is that that is not the most accurate way to measure homelessness, even though it's the official way. Just as a point of comparison, the National Healthcare for the Homeless Council works with community health centers across the country. There are about 1,400 of them who are federally funded to provide health care to vulnerable populations. And those health centers saw 1.2 million people experiencing homelessness in 2016. So that's a pretty big difference from the HUD estimate. And even that is not sufficient. Of course, not every community has a health center, but they may have people experiencing homelessness, so we're not getting everything there. And other estimates, including those by our friends at the National Law Center, think that it's probably closer to up to 3.5 million folks. We'll move on. I don't think we should be talking about homelessness without talking about racial disparity because it's so profound. This graph on your screen shows analysis of the reporting software from those community health centers that they have to report, but it mirrors other data sets in terms of the racial composition. And what I really want to point out here is that about 40% of the homeless population is Black. And you may expect that figure to kind of mirror the population of living in deep poverty, which according to one report is about 26%. But in fact, that's not the case. And so I think we need to keep in mind that Black people are particularly victimized by homelessness. So, and again, we focus at the council primarily on health care. And so I want to, and moreover, and when I'm talking to people outside of the healthcare community who are working on homelessness advocacy, I find that healthcare is seldom brought up. And so I just want to show you some of the health disparity statistics that we see in our work. People experiencing homelessness are expected to die 12 years earlier than the general population. And you can see on your screen certain statistics that are pretty profound. 49% of people experiencing homelessness experience depression compared to 8% of the general population. Substance use disorder, 58% to 16%. So what this means is that if you encounter somebody on the street, more than likely they are dealing with multiple chronic health conditions and illnesses, and they may also be self-medicating with drugs or alcohol. So I think that that's just important for us to keep in mind. Health problems are a major contributor to homelessness in the first place. I think that it's still the case that medical debt is one of the leading causes of personal bankruptcy. And if you get hurt and you cannot work, you may have no access to income, and then you may burn through any social connections that you have, such as your family or friends. And when that happens, homelessness is a result for a lot of people. And once you're on the street, any health problems that you do have are exacerbated. A simple infection or a cold can can get a lot worse because there's no safe place to recover, and you don't have as much access to medication. And again, homelessness causes a lot of health problems that house people may not experience. And so I think we should just keep these data in mind as we move forward. Just one more slide here about shelter arrangements. I've got two different data sources depicted on the screen. On the right-hand column is an analysis of the health center data, and then on the left you see the annual homeless assessment report. And the key point here is about 35% of the homeless population is unsheltered. And I think Eric can speak more to this, but in virtually no community is there enough shelter beds for the homeless population. So I'm now going to turn it over to Eric, who's going to share with us what his organization has recently reported about encampments. So take it away, Eric.
All right. Can you hear me, Michael?
Yes, we can.
All right. So thank you, and thanks for inviting us to be part of this webinar. As Michael said, we recently published our new report, Tent City USA, on communities' responses to the growth of encampments, and I'm happy to share some of those highlights with you today. The most important finding is, for those of us working in homelessness, generally, it's not just you. We feel like encampments are growing, and that's because they are, and rapidly. With the pro bono support of our partner law firms, we researched media reports over the past 10 years and found a whopping 1,342% increase in the number of unique homeless encampments reported in the media. And that trend is continuing based on the partial year data that we were able to get for 2017. So it's a very upwardly curving arc. We also found that encampments are everywhere. A total of 1,302 unique encampments in every state and the District of Columbia were found, and while California had by far the highest number, states as diverse as Iowa, Indiana, Louisiana, Michigan, Oregon, and Virginia all reported many encampments. So this is a growing problem. It's everywhere. These encampments are growing bigger. More than half the reports recorded the size of the encampments showed that they were 11 to 50 residents, and 17% of the encampments had more than 100 residents. Now, larger encampments are obviously more likely to garner more coverage in the news, which is where we got our information from. But at a minimum, these figures suggest that there are a high number of both medium and large encampments growing across the country. These encampments are becoming semi-permanent features of our cities. Close to 2/3 of the reports which recorded the time and existence of the encampments showed they had been there for more than a year, and more than 1/4 of them had been there for more than 5 years. But most of them are not sanctioned and under a constant threat of eviction. 3/4 of the reports which recorded the legal status of the encampments showed that they were illegal. Only 4% were reported to be fully legal, and 20% had some sort of tacit tolerance, but not fully legal status. And cities are responding to the growth of these encampments, but far too few are actually providing constructive approaches. Most, in fact, do not require any notice before they sweep or any storage of belongings if people are out while the sweep happens, and only a handful actually provide an offer of alternative housing or even basic shelter. Instead, we see many communities responding by simply trying to make it impossible for homeless people to shelter themselves, even as these Denver police did, ripping the blankets off of campers in the middle of winter under the excuse that they needed to seize them as evidence of a crime, the crime being trying to survive on the streets. In fact, an increasing number of cities criminalize camping, making it illegal for homeless people to shelter themselves, but not providing adequate alternatives or even telling them where they might be able to go instead. So as this graphic shows, we've got about 1/3 of cities prohibiting camping citywide, and about half of them in particular places, and those are increases of 69% and 48% respectively between 2006 and 2016. So these laws are on the rise. And it's not just camping. We've been tracking 187 cities across the U.S. for the past 10 years, and we found a dramatic increase in all forms of criminalization: sleeping, camping, sitting and lying, loitering, panhandling, and food sharing laws. And all of this data, both from the Encampments report and the criminalization report here, is available down in the resources pod on the bottom of your screen. And As we know, the criminalization approach is expensive. Cities are spending millions of dollars each year between police time, jail costs, and sanitation efforts. And it puts both law enforcement and homeless residents at risk, and it decreases rather than increases public safety. Most law enforcement officers didn't join the force to harass homeless people, and they would rather be out fighting real crime and not stuck dealing with people in crisis that they're not adequately trained for. Moreover, criminalization doesn't work, especially when there isn't enough housing or shelter accessible to people. Often when law enforcement tells residents of encampments to go to a shelter, they risk either finding the shelter full, or even if a shelter bed is open, it's not always appropriate or even adequate for all people. People experiencing homelessness learn that while shelters may exist, they are not really accessible to them, so they no more choose to live in an encampment than a person in a wheelchair chooses not to go into a building that only has stairs to the front door. Yeah, it might not be inaccessible to most of us, but to them, it's not a real choice. And in fact, the most important choices have already been made for them. Those are the choices that saw federal funding for affordable housing fall by more than 50% from its high in 1978, and it's never been made up at the state or local level. In places like California, they've known for decades that they've needed to be investing in hundreds of thousands of more affordable housing units for every year for decades, but they haven't been. And the result is now that more than a third of renters in California are paying more than 50% of their income on rent each month. That puts them just one missed paycheck or one emergency car repair or medical procedure away from ending up on the sidewalks of LA, San Francisco, or elsewhere. And many other states aren't much better. However, there are some better practices out there. In 2015, the U.S. Interagency Council on Homelessness issued a report setting out best practice procedures for ending homelessness for people living in encampments, making sure that the encampment is closed permanently because all the people who needed it are adequately housed instead. And we've built on this guidance with 6 new principles and accompanying practices developed through interviews with government officials, advocates, service providers, and the people who actually live in those encampments. And these are collected both in our 10th city report as well as the encampment one-pager, again available in the pod below. I'm going to go quickly through the 6 principles because I think they're really important in setting a framework by which any community can hold itself accountable to practices that are actually going to be effective in addressing encampments in the community. And the most important of these is that as human beings, we all need a safe, accessible, legal place to be both day and night and to securely store our belongings until permanent housing is found. We emphasize that we do not accept that homeless encampments should be permanent features of American cities. We can and we must do better by our fellow citizens than to let them live in shanty towns on the peripheries of our cities. So the first commitment should be to finding permanent solutions. But that said, until those solutions are found, cities should find ways of ensuring that everyone has access to the basic elements they need to survive with dignity and that they aren't unnecessarily pushing them into the expensive criminal justice system. Second, these approaches need to be guided by those directly affected by them. People living in encampments have been improvising their own solutions for decades. Rather than imposing top-down approaches that meet the needs of elected officials or those not living in the encampments and then forcing the people in those encampments to comply, communities should be looking to the expertise of those living in the encampments and work with them to develop the solutions that will work for all, and that is an inclusive all. Third, we know that encampments can't be permanent features of our cities, but moving people without a plan only makes things worse, and it makes the problem go somewhere else, and where you have clear procedures, those protect the interests of homeless persons, law enforcement, service providers, and other city residents alike. Fourth, while we do not want encampments to become permanent, we recognize that they may play a temporary role in improving living conditions for those living on the streets and preventing them from being further criminalized. So for cities considering legalizing encampments, we set forth several considerations for ensuring it's as close to fully adequate housing as possible. Fifth, when homeless individuals are transitioned out of encampments, they must not simply be told that there's a mat on the floor for you somewhere if that mat on the floor is not appropriate, for example, for a domestic violence survivor concerned about her safety, or a person with other disabilities that makes it not a real option. So alternatives to encampments must be real alternatives, allowing people to bring their pets, possessions, and partners to a safe, habitable, affordable, accessible place, whether it's a temporary solution or permanent housing. And last, while we believe the existence of encampments is a social service issue and not a criminal justice one, law enforcement does have a role to play, but is one that should be that which supports the needs of all members in the community, both housed and unhoused. So in parallel with these recommendations, we've also been working with the National Healthcare for the Homeless Council on a draft statement on encampments that addresses how healthcare providers in particular should deal with encampments in their roles as healthcare providers, as partners with local government, and as advocates. And that document, I believe, is forthcoming, and we will be discussing it at our session at the conference coming up in May. So if you are going to be there, please come to our session, and we can continue this conversation there. The heart of our report is beyond these principles is the case studies of the cities that have actually taken positive approaches to existing encampments and those who are looking to integrate encampments as part of a comprehensive approach to ending homelessness. No city is perfect, but we pull out many of the positive elements in our report, as well as commenting on things that could be improved. We don't have time for all of those case studies on this webinar, but hopefully Jeff will address some of what happened in Charleston in his presentation, and I encourage people looking for inspiration to look at our report for the details on what these cities did, how they did it, and how they actually got the political and other pieces lined up so that they could actually put things into practice. Those are all available in the report. And also in our report, we look at the developing legal landscape surrounding encampments, which I'm happy to answer questions about later. But for now, I will turn it back over to Michael.
Great. Thank you so much, Eric. Before we pivot to our case study, which was one of the first on Eric's previous slide in Charleston, I just want to reflect on how we got to this place where not only is homelessness increasing, in encampments in particular, unsheltered homelessness is increasing. And so on your screen, I've broken these things into two categories, a history of kind of how we got to a homeless crisis, really, and then ongoing drivers that continues to cause people to fall into homelessness. And so in short, the story has several kind of major occurrences that affected a big spike in homelessness, and that included a huge cut to HUD. The HUD budget is currently a fraction of what it was in the 70s, and this is not a political statement. It just is the case that investment in affordable housing was just severely cut. We also saw deinstitutionalization of mental health institutions, mass incarceration, the war on drugs played a huge role. And of course, the Fair Housing Act was never fully implemented, and it is still not enforced to its full extent. And so as we look at the things that continue to drive homelessness today, and I think many of you know this, but I think the singular issue is that housing has become so unaffordable. Our friends at the National Low-Income Housing Coalition produce this report every year that calculates the housing wage. And I think this most recent report showed that maybe in 2 counties in the United States, Can you afford fair market rent, earning minimum wage while working no more than 40 hours a week? And so it's just become incredibly expensive to have housing in the United States. Some of these are structural and others are more personal issues. Of course, the opioid epidemic has gotten a lot of recent press attention. Of course, we're aware of how that interacts with homelessness. I also want to emphasize LGBTQ plus discrimination. True Colors Fund reports that 40% of youth experiencing homelessness identify as LGBT, and that's a major reason discrimination against their sexual and gender identities is why they lose their housing. And of course, lack of access to health care is another important piece of it. So the main point that I like to bring up when I'm talking to people about homelessness is that it is not a character flaw. It is not a personal characteristic. People experiencing homelessness are not some other genre of human being. But in fact, homelessness is fundamentally a housing status. And when you get people into housing, they are no longer homeless. And I think most of us know that. Just a couple slides on trauma. I don't want to get too deep into this, but in case of not everybody is aware, of course, trauma-informed care is sort of a buzzword in the mainstream now, although it's been a fundamental part of healthcare for the homeless for a very long time. But what more people are beginning to realize is that most people experiencing homelessness have experienced traumatic events. And in fact, homelessness itself is traumatizing and re-traumatizing. And once you've had that trauma, escaping from homelessness, finding work, sustaining work, finding benefits, makes it incredibly difficult. The National Council produced a report a few years ago on the violence among people experiencing homelessness and found that about half of people experienced homelessness in the study were victims of a violent attack while they were homeless. And so I think that really challenges some of the stereotypes about homelessness, and because in fact people without homes are much more likely to be victims of attack than perpetrators of it. And so our response to that in healthcare for the homeless and other services is trauma-informed care. And rather than get deep into the weeds in this, I do want to just promote the Council's online course, which is really a 4-part webinar series produced by Matt Bennett, who is a nationally recognized expert on trauma and homelessness. So you can find that on our website, and that link may be live on the screen. But I think anybody who is just beginning to think about better ways, constructive ways of dealing with homeless folks needs to understand trauma. So now we are going to jump into our case study, and I'm really pleased to have Jeff Youngman on the call. He's not only doing really great work in Charleston as a provider, but he's got this unique perspective as a former police officer, and so I expect to learn a lot from Jeff. So take it away, Jeff.
Great. Thanks, Michael. You all can hear me?
Yes, we can.
Great, thanks. Let me just do a little introduction about 180 Place, the Homeless Justice Project. 180 Place itself is the homeless shelter in Charleston, South Carolina. I've been here for 19 years. Was formerly the clinical director, but then went to law school. And in 2007, in partnership, as it says, with the Charleston School of Law, Charleston Pro Bono Legal Services, and Nelson Mullins, we started a legal clinic here that then morphed into the Charleston, or the 180 Place Homeless Justice Project when I graduated. We are staffed by myself and another attorney, one who's a former police officer, of course that's me, and a paralegal. We provide free civil legal services to anybody in the Charleston area who is experiencing homelessness or who is at risk of being homeless. Last year we served 538 clients with 690 legal issues. Before I talk about Tent City, or what we call Tent City, and the encampment, and how we work to deal with that issue, I think I need to step back a second and talk about panhandling, which sort of, the panhandling then flowed into the Tent City issue. Panhandling comes about when cities target or arrest for panhandling or citations for panhandling comes when cities target poor and homeless individuals that passes laws to prohibit the panhandling. But it is really a First Amendment issue. Courts overwhelmingly have found that begging is protected by free speech because it's a form of communication, and you cannot target speech based on its content or form. So panhandling itself is not a criminal act. In 2013, myself and a representative from the ACLU went to the City of Charleston and said, your ordinance as it stands is unconstitutional, is a violation of free speech, and something needs to be done to change that. And fortunately, they agreed without having us take the matter to court. The original panhandling rules back in 1975 forbade a person from placing himself in any public way or place to beg or receive alms for himself. So in South Carolina, we still referred to alms in 1975. What would happen is that police would regularly stop pedestrians and ask them when they saw that they had been approached by an individual, would stop and ask them, what did that person say to you? And then if they said they asked for money, then they would ticket the person who was panhandling. This went on, and then stores started putting up signs like the one I have there. It says, don't feed the bums, as a way to try to get panhandlers away from their premises. In 2007, they retooled the ordinance, adding a requirement that beggars, so we moved from alms to beggars, obtain a permit to solicit. But few people came forward to do that. Nobody was going to ask for a permit to ask for money. So that ordinance really wasn't followed that well. In March 2014, a new ordinance was enacted allowing panhandling on city streets, but not, quote, aggressive panhandling, or panhandling within 50 feet of an ATM. In addition to ATM, they added banks, hotels, hospitals, churches, and schools. So when that ordinance changed and it allowed individuals to panhandle, the reaction in Charleston, it just amazed me. The hatred and vitriol reaction for panhandlers was amazing. I would never have guessed it to be this way. The headlines in the paper said Charleston intersections are overrun with panhandlers. The image of the city has declined due to panhandlers being unofficial greeters to tourists. For those of you who don't know Charleston, the city of Charleston is on a peninsula. There's only 3 main routes into the city, and people panhandling would stop at those intersections, and as people were coming off the ramps from the bridges or from the interstate, they would ask for money. And the people with the Chamber of Commerce and the Visitor Center and everything did not like the fact that these were the unofficial greeters to tourists coming to Charleston. And so it contributed to a negative perception of Charleston. As a result, there was pressure put on the local officials to reenact the 2007 ordinance that was the one I mentioned about alms and beggars. In addition to just the reaction, public reaction in general, a group called the Holy City Panhandlers were formed, as it says, to expose professional panhandlers that infiltrated our city on every street corner. This group seemed to think that there was this professional group that came in to make, I guess, lots of money off of panhandling, and were organizing these panhandlers for what means, since most of the folks we talked to that panhandle would make about $30 a day. So it wasn't, they weren't doing a whole lot with it. 30, sometimes a little more, but around there. The group members, as I said, would videotape and harass people who were panhandling, and they also launched the Operation Bum Free Corners, designed to raid panhandling locations and try to push the panhandlers out of Charleston. The reaction on our end, 180 Place, is not something I'm very proud of, in that in public we said in the newspaper it's not our problem. Meaning, I think that it was not our problem, that it's a community problem and not a problem that 180 Place, the homeless shelter, had to solve, which is true. It is a community problem, but I think we missed a great opportunity to get in the paper, because it was in the paper almost daily, and to address reasons for homelessness and why people had to resort to panhandling. And we did not do that. We should have, and we missed the boat there. On the other hand, the police department made sure panhandling was conducted in a safe and lawful manner. They connected the panhandlers with homeless services if they needed, and they also made sure that those groups that were involved in Operation Bum-Free Corners did not harass and attack or bother the people that were panhandling. So the police department did a fine job in keeping this matter to where it did not get violent or not get abusive to the folks trying to panhandle. But as I said, in 2004, and City Council did succumb to pressure and enacted the new law in 2014 that took effect in 2015 and labeled it a public safety issue, saying that people in intersections were endangering themselves and endangering people that are driving because of stopping people to ask for money. So they didn't make it a free speech issue, they made it a public safety issue. The reaction to new ordinance, as I said, prohibited anyone from passing items to or from an occupant of a vehicle or roadway or traffic lane with a maximum penalty of 30 days in jail or a fine of $1,092. So if you're panhandling, making $30 a day, you cannot afford a fine of $1,092. But what the police department did, and again, they handled this very well, is they enacted a 30-day education campaign by the police, handing out explanation of the ordinance rather than citing people. So for the first 30 days, no one, even though the law had changed, nobody was cited for panhandling. They were given these notices that this is what could happen if you continue panhandling. So it prevented people being either cited or jailed for something that had been something they were doing on a regular basis. Okay. But there was an unintended consequence of the panhandling or the new law that prohibited panhandling the way it was being done. And that became that people started sleeping in public because they didn't have the money that they were making on panhandling to pay for a hotel room for the night. When there is no inadequate shelter space, people are homeless, have no alternative but to sleep in public. And arresting those who do violates the Eighth Amendment right to be free from cruel and unusual punishment. Also, city sweeps, as Eric mentioned in his presentation, where people live outside can violate the Fourth Amendment right to be free from unreasonable search and seizures and due process rights. And I cite a case in Boise where the Department of Justice actually, under our previous president, filed a friend of the court brief citing that this thing when Boise was trying to keep people from sleeping in public, where the city of Boise was trying to keep people from sleeping in public. Here's a couple pictures of Tent City that we had. This was under a ramp leading from the Interstate 26 into the city. It was property owned by the Department of Transportation, so initially the City of Charleston had no authority over this area to move people out or go into this area. As I said, this became an unintended consequence of the panhandling ordinance that came about. And by December 2015, there were up to 120 people living in the Tent City. There were multiple locations at Tent City, all within 2 to 3 blocks of 180 Place. There were, I can think of 3 locations offhand that we would visit. But like I said, 120 people in these 3 locations, which for some cities is not a large number. For Charleston, it was a huge number. We had never encountered a encampment like this before. There's certainly been encampments around the city for as long as I've worked at 180 Place, but nothing of this magnitude. Amazingly, the reaction to Tent City was completely opposite of the panhandling. Churches and other organizations began providing meals nightly for individuals living in Tent City. There was even had to be a schedule had to be developed because multiple groups were coming nightly to provide food for people staying in Tent City. So they had to come up with a plan so only one group would come per night. There were constant delivering of clothes, hygiene supplies, and additional tents dropped off for well-meaning people who thought they were helping the folks in Tent City. When we would do outreach there, and we did outreach on a fairly regular basis to see why the individuals are there and what we could do both as an agency at 180 Place and legally through the Homeless Justice Project to help these individuals with whatever the issues they had that were causing them to be in Tent City. Some of the folks had 2 and 3 tents, one for themselves to sleep in, and 2 to just house the supplies they had received from people bringing supplies to them in Tent City. And it became, as it says there, a conflict between 2 competing philosophies: the enablers who were allowing people to remain there because they were feeding them and providing them with hygiene supplies, and the city even set up portalets, etc. And those who wanted to solve the problem, which was 180 Place and a group of other individuals. So we began a partnership with Low Country Homeless Coalition, the City of Charleston, including the police department, and others in the community who wanted to plan to find services and shelter and some kind of permanent housing for those folks in Tent City. It says the strategy was designed to resolve the issue humanely, and that was the most important part. This was not going to be a sweep. This was not going to be a rousting of folks out of in the middle of the night. It was going to be a humane way to try to find housing for those people in Tent City. So starting in February 2016, one encampment after another was cleared out. Like I said, there was 120 people in Tent City, and its peak. Out of those, 22 came into 180 Place shelter. 23 went into permanent supporting housing that we had available for them. 40 went to a transitional housing center that the city created until we could find until we had openings at 180 Place, or we could find other permanent supportive housing for them. And the remainder went to family and other encampments. We still certainly have encampments in Charleston. We don't have any that are at 120 people level, but we know they're out there. We have outreach staff that know they're out there and go visit them and try to get them to seek other kind of living situation. But they're there, but not as they were in Tent City times. The most important thing was that there were 0 citations, no arrests, and no destruction of the belongings of anybody that was in that Tent City. And to my knowledge, only 1 couple had dogs in Tent City, and as Eric mentioned in his presentation, pets are an issue. 180 Place does not take pets unless they're service dogs. But so this couple did not want to come into Tent City because they had 2 dogs. So one of our staff agreed to babysit the dogs for the 2 months that they were there until they could find housing on their own. The other reaction to Tent City is that the city developed the Homeless to Hope Fund, which was later named the HAT Fund after an individual who passed away last year, who was homeless and always wore a yellow plastic construction cap and hat, and everybody called him Hat. So it was renamed the HAT Fund after this individual. But this allowed private citizens to make donations to support efforts to address homelessness in the city. 2 months ago, they had a major concert here in the city with all the number of acts, and all that income from that concert went to the Homeless to Hope Fund. And the Mayor's Commission on Homelessness and Affordable Housing was also created to come up with strategies to provide more affordable housing and services to the homeless population. One of the things that have come out of this commission is that the city is opening a day shelter or a drop-in center just a block from 180 Place that will allow folks to come there during the day and that aren't staying at 180 Place or that are homeless to have a shower, to get their mail, to see people about getting services, etc. Let me go back because I've got one more thing. Before Tent City, I just want a couple things that aren't on slides. Before Tent City started, we did do training with the new recruits for the Charleston Police Department and the North Charleston Police Department to give them some idea about homelessness issues, why people are homeless, what they're dealing with, and how to work with people homeless, and how to give those people some options of where to go. So I think that helped when we got to this point with Tent City, is that at least the new recruits and those that have been there for a while understood that there were some other options for people that were homeless, and they didn't. There was no need for the citations and no need to tear down the Tent City, that something was being done for it. And as I said, those encampments still exist, but again, the police are not rousting those folks and taking their belongings away. They're contacting us or contacting our outreach team to go out and talk to those folks. One last thing, about a month ago, the whole panhandling issue came to the forefront again here in Charleston because as the city gentrifies, people are moving up and up into areas that before were not areas where people would come on a regular basis. And the new store owners there were complaining about people panhandling in that area. And Lieutenant King, who is the lieutenant that is in the area that is in the same area where 180 Place is, was quoted in the paper as saying, issuing citations and making arrests doesn't always curb behavior. He said, police are proud to have a more compassionate approach. We're not going to arrest our way out of homelessness, which I thought was refreshing change in a way that that police should react to this issue. Speaking as an ex-police officer, there is a lot of discretion when you're a police officer on who to arrest and who not to arrest in issues like trespassing and open containers and loitering and things of that nature. So there is a way to address these, to get folks that are homeless, get them the help they need without citing them and having them either have to pay. In Charleston, a trespassing fine is $472. If you're homeless, you don't have $472. So those issues need to be addressed and can be addressed other ways than arrest. So, Michael, I guess I turn it back over to you now.
Yeah, thank you so much, Jeff. We really value what you're able to do in Charleston or continuing to do. I'm going to turn it back over to Eric, who's going to kind of share what his organization is doing around collecting data on police training programs. So Eric, take it away.
Yeah, so as Jeff said, where you do that kind of sensitization education with the police department, it can make a difference not only in individual cases, but also systemically on the policy side, where you have, a current debate about, should we increase penalties for panhandling? Should we turn to a criminal justice approach? And you have, one of the law enforcement officers who'd be enforcing that policy standing up and saying, this is not the answer, guys. That's really valuable. So as part of our National Housing Not Handcuffs campaign, we have been collecting information about cities with either programs for training law enforcement officers on interacting with homeless persons or who have homeless outreach teams who are working collaboratively with social and health service providers in the community. And we have a running list of almost 50 programs on a Google Doc with the link there at the bottom of your screen. And we are happy to share that with folks, with the only condition being that your use of the list is conditioned on being that you have to participate in updating it with more information if you have any on any of these communities, or how well those programs are actually being implemented, or if there are ones that aren't listed on there, on adding that in. We want to keep this as a living document and grow the number of programs that we're able to help share with other people. So this document has a lot of great information. It's, as much as we've been able to collect so far over the past few months, but there are highlights, including some training programs in places like San Francisco and Washington, D.C., where every single new recruit into the police department gets a day or a couple of hours at least of training, including direct experience by people either currently or formerly experiencing homelessness on sensitivity, as well as crisis intervention techniques. And there are actually more cities than you might expect that have smaller teams who are trained in partnering with outreach services. So there's a lot of really good examples of these. this is an area which has definitely kind of exploded over the past few years. Just anecdotally, I think the first one of these outreach teams I heard about, maybe 6 or 7 years ago, and it was either, they were making it up from scratch, but you don't need to make it up from scratch. There's a lot of folks out there who could give guidance to your law enforcement or to you as an organization if you want to go about trying to do a training with the department. Additionally, in December of 2015, we worked with the Community-Oriented Policing Services Division of the Department of Justice to put out an entire issue of their e-newsletter dedicated to looking at constructive roles that law enforcement can play in ending homelessness. The articles there emphasize that when police build positive relationships with homeless members of the community and can focus more of their time on fighting real crime, everyone is safer. And when social service workers are able to take the lead with people in crisis, it ensures the best outcome for homeless individuals and the police alike. So these articles are a great tool to bring to your local police department and show them and say, it's not just us crazy homeless advocates who are trying to do this, but, this is the Federal Department of Justice is actively encouraging this as best practices in policing. And again, if you just look for the December 2015 issue of the Cops Dispatch, if you Google that, I'm sure you can find it. Or we'll send the link after the webinar. And all of this is reinforced by the endorsements that we've gotten from law enforcement officers for our National Housing Not Handcuffs campaign, which you can find on our campaign website, housing.handcuffs.org, and then click on the endorsements link. If you aren't an endorser of the campaign yet, you should be, so please go there and endorse. But also, if you find any supportive law enforcement officers who resonate with this, please encourage them to endorse the campaign as well, and we can add them to this list and show more people across the country that this, law enforcement is supportive of constructive solutions around homelessness and not wanting to be the only solution communities are proposing to issues of homelessness. And many of those endorsers on our list come from a group called the Law Enforcement Action Partnership, or LEAP, which is a new group of law enforcement officers who are speaking out in favor of reducing our over-reliance on criminal justice to solve social service problems. And indeed, we just had one of their speakers on a previous webinar that we did a few months ago on encampments, and then last month, one of their members co-authored an op-ed with us supporting the Colorado Right to Rest Act. So these are services that they can provide in your community. They're a great resource for people looking to have law enforcement speaking out, for doing peer-to-peer messaging with fellow law enforcement officers and encouraging them on best practices, doing op-eds. One of them came and testified at a hearing on the Colorado Right to Rest Act. So they're a fantastic resource, and you can find them online, or you can reach out to me, and I'm happy to put you in touch with them. So those are the tools that I wanted to share. There's one additional, actually, which is the National Data-Driven Justice Initiative, which was started by the White House in 2016 and is now being run by the National Association of Counties. And these are more than 130 jurisdictions across the country that are committed to smart solutions to end homelessness, which involves diverting people out of the criminal justice system and into social services. So you can find their list if you look up Data-Driven Justice on the NACO website, National Association of Counties. And if your county or there's some states and some cities as well participating, then there should be at least somebody in the administration there who would be open to these kinds of constructive solutions. And there are a lot of sheriff's offices and corrections officers, lots of law enforcement there who are also very interested in these kinds of solutions.
Great. Thank you, Eric. We have just about 5 minutes left, so I just want to draw everyone's attention to the resources pod on your screen. You can click on those things and then download them. It includes a lot of the reports that we've mentioned. You can ask questions in the pod below the presentation slides, and we'll try to get to them. Just, you see on your screen what we've put as general recommendations. I think we've emphasized these a lot. Especially I want to call out those of us in the Healthcare for the Homeless community who are on this webinar. If you have a consumer advisory board or some consumer group, I think it's a great opportunity to use your clients with the lived experience to help train law enforcement. I think their stories are a really powerful tool. And of course, those of you who are in law enforcement, we thank you for being on this webinar, and we hope that you'll engage with your local provider community. I'm going to turn now to Q&A. There's a question about which counties can you afford fair market rent, making minimum wage. Thank you, Beth, for that question. So this comes from the Out of Reach report, and we have added that to the resource pod on your screen that you can download. I think the citation I probably had in mind, and again, I was just kind of recalling from the first time I read it, but we found in only 12 counties can a full-time worker earn the prevailing federal or state minimum wage. Someone who works full-time at the state minimum wage, can they afford a one-bedroom rental home at the fair market rent without paying more than 30% of their income on rent? So I think that's where that came from, and thank you for that question. Brittany asks, and says, I hope this doesn't come across as insensitive, but we are generally trying to support friendly policies but are having a hard time finding a balance. How are communities working through issues with local homeless people needing services by being overshadowed by people traveling in and through the town who are participating in dangerous, threatening, or illegal activities such as harassing people on the street or littering or defecating on the street? We want to have supportive policies and infrastructure, but how do we deal with folks who won't use those resources or who are breaking the laws? Jeff, I'm going to put that to you to see if you have a response.
Well, I think one way to do it is we have 2 outreach workers right now, and hiring a third, I believe, that their job is to go out, or their role is to go out and talk to people that are in the community that aren't housed to see what the reasons are for them not being housed and what we can do to try to help them. But, you know, again, looking at from my former law enforcement eyes, people that do some behaviors, I don't think there's any option. You can try to be compassionate, but sometimes police have to act in the best interest of the community. And so if somebody's coming into your town and creating havoc or causing problems or harassing people, then other means have to be taken. One thing, though, we do have in Charleston a crisis stabilization unit, which the police have started to utilize frequently for individuals who are behaving in a way that is not criminal, but is in a way that is maybe dangerous to themselves or others, and they can be taken to this crisis stabilization unit, get stabilized, if they need to be on medication, and be treated for their behaviors rather than being arrested for their behaviors.
And this is Eric. I would just add, if people are genuinely acting in ways that are dangerous, there are already laws on the books that are more than adequate for dealing with that. That's assault, that's battery, so there's no need to pass additional laws to criminalize different aspects of homelessness. These so-called aggressive panhandling laws, there's no need for that, because if you're threatening somebody, that's assault. If you threaten them and you touch them, that's battery. So that's all you need already. But so there's no need for additional laws. The best thing really I've seen out there is cities have done surveys of homeless people to find out who's actually out there. And while it may be the most visible people are these ones who are kind of coming in, more nomadic types, the vast majority of people are those who are from the community. And doing a survey and finding that data out can often help to reframe the conversation and say, we need maybe one set of solutions for these folks, another set of solutions for these folks, but it helps to open the conversation up to say most of the people out on the streets are our own community members that our community has failed, as opposed to these outsiders who we just need to push out of town. And that can help, like I say, kind of open up the conversation to more constructive solutions.
Yeah, and we are out of time. I'm going to go ahead and ask Jeff or Eric to respond to Kelly's question, and then we'll conclude, and then respond to other questions after we conclude. You can email us, and we'll respond. She says in D.C., police are currently targeting homeless and threatening incarceration for utilizing public spaces to access federal organizations to conduct their personal business. How would you suggest homeless individuals defend themselves against this targeted violation under the color of the law?
Yeah, so Kelly and I are in touch, and we can continue to be in touch. And yeah, so we can move on to another question.
Okay. Let's just quickly mention, Glorine says, I do not see Puerto Rico in the list of places where police training happens. Information and material was shared in Spanish. Our program impacts the whole island, so does all cities. So I'm so glad to hear that that's happening in Puerto Rico, and we hope we can get that added to the list. So we need to wrap up. I'm sorry we didn't get to all the questions. We really thank everyone for your time today. When we conclude the webinar, a survey will automatically appear in your web browser, and we really want you to fill that out because this is our first attempt as the council entering this space, and we really hope this is the beginning of a conversation that will lead to more productive resources. So please complete that survey, and we really thank you, everybody, for your time today. So this